Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to discuss another non-surgical treatment of a Class 3 case by removing the 6-year molars. Don't have it up here in the start of the case to show you that, but we did. We took the 6-year molars on the bottom out. He had wisdom teeth down there. In this case, with vertical height of the face was okay, and the case worked out better. If the vertical height is too much, you're better off to go ahead and do the surgery, but the difference in the cost is vastly different to do that. So anyway, we can come out with a good result if we don't have to lower this vertical height very much. So let's get going with this case, and it's like many of the others. It looks like he's on the excess a little more for face down here than we need. And he's a Class 3, and this molar is out too far forward here, and these teeth are out past this. This is a rather mild Class 3 case. See, but then to get these teeth back underneath here, you're going to have to do a lot. So we didn't have to move it too much, so we could move the upper teeth forward a lot here. So we're going to take this out, and we'll bring this tooth bodily, and we'll have this tooth over here, over in this space, and it'll be level like it is here. And what you do, the best way when you're running your archwire back here, I've shown you what makes your little loop like that come off, pull this up in here, and tie from here to the back, and if you've got enough force on this, the roots will follow the crown. If you don't, if the crown starts running out, you have to slack off on the pressure you're putting here, or put more tip in these teeth to make the roots come forward. So you want these roots to be up above the tooth just like that. So we want to carry that over here. Now we've been through this so many times, and this method of doing Class 3s works. It's all orthodontically done. Now we're going to go in and correct that, move this tooth out, and we're going to spread these out. Many of these are mouth breathers, and the maxilla is fitting together and smaller than the bottom teeth. The tongue presses that out. Now this young man is like, he's nearly 20 years old when we start this. And these are perfectly good 6-year molars, and he's got second molars and third molars already in. We know they're there, so we're going to pull these up here, go back here just a little bit, and then we'll pull all this, and we'll pull this forward also up above. There's the space, and the teeth are coming forward, and they're coming forward bodily. All right, we kept going with that. We got to put a little more kick in this one to get the roots further forward. Now we've apparently put more bend in that, and the teeth are coming forward now. And they'll come up in here. The wisdom tooth above has nothing under it. You can leave it alone. If it comes down and bothers them, then we have it removed. We've just about closed that. You see this tooth has moved forward bodily. Over here we will come forward the same way. It looks like we lost bone structure, but I think we could see that again. Now this is kind of distorted. This is really going further out. right here. All right, there we are. Closing that space again. Same person. I've just got some duplicate slides here. Anyway, we finished the guy out with this, and now he's finished completely, and we're pulling those teeth up. And let's take a look at him as he finishes up. So here he is. I don't have the finished pictures of his face without the braces and everything, but the teeth are underneath and the upper teeth are out in front, and the upper jaw is widened and matches up better. So thank you for watching. You can go in and check this case and see. So we just gave you a whole line of these cases, and we're going to try to get everybody realizing that you can do a lot of class 3 surgical cases without the surgery. You can go in and do the 6-year molars on the bottom. So thanks for watching, and I'll sign out here. And I hope you'll join our group, and we'll see you later. So bye-bye.